Hey there. Thank you so much for being here today. Welcome, welcome, welcome. I'm Dr. Perkins, a board-certified OBGYN, and today we're talking about when to check thyroid levels after pregnancy. Now, after pregnancy and during your postpartum period, there are just so many hormones and things can seem so chaotic that it might be confusing whether or not your thyroid is the reason why you're feeling the way you are, or just regular normal postpartum changes. So let's talk about why thyroid problems are very common after pregnancy, when to check your thyroid levels after pregnancy, and what tests to ask for. Pregnancy is such a journey. Delivering your baby is another journey. Postpartum is a whole nother world. If you've been there, you know. If you've never been there, heads up, it is coming, okay? And pregnancy is really beautiful and something beautiful comes out of it. But understand that pregnancy takes a lot from us. We are undergoing a really tough and complex situation that leads to a beautiful life, but really depletes us within. And it requires every single cell of our bodies to change course in order to bring life. And so we don't take this, lightly. Your body goes through a lot. Pregnancy is actually considered to be a disease, a dis-ease. Now, once you are postpartum and we're healing and recovering and enjoying our little one, know that 5 to 10% of people in the postpartum period may develop an infection of their thyroid called postpartum thyroiditis. This can happen anytime within the first year of delivering your baby, and it often will go unnoticed because the symptoms that you feel during that time is very similar to what you would normally feel in the postpartum period. And honestly, I feel as though a lot of times, because we don't have a book or something to really guide us through parenting and the postpartum changes, we hear of things and we know they exist. But if this is your first time going through the process, you may feel as though your symptoms are completely normal. Like maybe this is what everyone undergoes. But what I want you to take away here is that if you're not feeling better from day to day, from week to week, especially within the first couple of weeks of delivering your baby, this is something that you should talk to your doctor about. We often will see you at the 6-week point after delivering your baby for a routine visit and to say the postpartum period is over, but it actually isn't. If anything, you're in the earliest phases of postpartum changes and healing at that time, but we don't schedule another appointment for you after 6 weeks, right? So you're left on your own. But if you have any symptoms that could be reflective of having an underlying thyroid issue, it is very important that you go back to your doctors, schedule that appointment, get there face to face, talk about what you're feeling so that we can intervene, so that we can do testing and we can give you the treatment and the help that you need and you deserve. Now, there are 2 phases to postpartum thyroid issues. The first usually happens within the first 6 months after you deliver your baby. This phase often reflects hypothyroidism or a very underactive thyroid. And so the symptoms that comes with that may include weight gain. It is cold intolerance, meaning that you're just really cold all the time, feeling extremely fatigued from day to day. You may also feel an overwhelming amount of depressive types of feelings. Phase 2, which is oftentimes between months 6 and 12, the opposite might happen. This is where we may be more similar to having hyperactive thyroid. With this, you may be more intolerant to heat. You may lose a lot of weight. You may find that you're very jittery and anxious and just overactive. This is very common if you happen to be one of the 10% of people who may experience this after delivering a baby. So now the question here is, well, when do I get testing? When do I check to see if something is wrong? If you're high risk, meaning that you have a history of a thyroid dysfunction or thyroid disorder, if you've had positive antibodies to thyroid previously, if you have a history of type 1 diabetes, or if you've had postpartum thyroiditis before in the past, then you should have your thyroid checked right around the 3-month mark. If you develop symptoms and are questioning whether or not you have this, symptoms such as feeling like your heart is racing in your chest, feeling anxious, feeling extreme fatigue. If you're having hair loss, which we know hair loss is a part of the postpartum package, but excessive hair loss, if you're struggling with weight gain or inability to lose weight, if you're feeling unusually hot or cold, if you have very low milk supply, or if you're struggling with depression, these are all symptoms that should bring you to the doctor's office and for testing immediately upon noticing that these symptoms exist. Definitely, if you've had thyroid issues during your pregnancy, usually with this situation, we would schedule you for thyroid testing right around that 6-week mark. Testing matters because treating an underlying thyroid problem is important for helping you to feel better. It's helping you to navigate the postpartum world. It will help you to feel your best. When you're your best, then you can care for your child. You can care for your family. You can get back to a normal pre-pregnancy state much smoother than if you have symptoms that are undiagnosed or a condition that's undiagnosed and not getting treatment. So what do you ask for? Well, make an appointment, talk about your symptoms, and ask your doctors to do and to run a thyroid panel. That panel usually incorporates testing TSH, which is your thyroid stimulating hormone. This is a hormone that is released by your brain, communicating with your thyroid for it to produce or stop producing hormones. So we want to know what that level is. That's the first and the most important one. The panel also includes checking free hormone that is just hanging in your blood. These are specifically coming from your thyroid. They include T3 and T4. Now, T4 is the most important of the two. And so if you were to get a TSH and a free T4, that will give us a good picture about what's happening internally. Your doctor may also include antibodies because we know that there could be an autoimmune component to having postpartum thyroiditis or really and truly having any underlying thyroid dysfunction. So we've talked about a lot today. Postpartum thyroid changes is one that really can impact us, how we're feeling, how we are. And so it's really important that we understand what our symptoms are, discuss them with a provider, and get testing done. Your hormones shift dramatically after pregnancy. And so to help you through this journey, and because you've been listening here with us throughout the duration of this video, I'd like to offer you a free gift. I'd love to send you a free copy of my ebook, Hormones Don't Lie, because it is a very complicated world trying to understand and navigate our hormones, especially when you have questions. And I'd like to meet you right where you are. I'd love to send this to you. The link is below this video in the description area. Just click on that and I'll send it your way. I hope you've learned something today. I hope you've enjoyed being here. I thank you for listening in and I hope to see you next time.